I think that every jersey that's hanging up, to me, represents somebody's story. They see the players out on the field and the athletes doing their things in the competition, and they don't see all the behind the scenes, all the hours that that person put in to get him back on the field.
After you.
Thank you.
So you had surgery about 6 weeks ago on your right knee.
Yes.
So you're not totally out right now, or are you totally
Yeah,
out?
I can't compete right
Okay.
now. Yeah.
So every time I see a jersey or, a photograph of one of my patients or something like that, it just reminds me about the hard work and dedication that they put in to get back.
Hey, how's it going?
Good.
Had you ever operated on a professional hybrid athlete before?
I have. So we've operated on many professional athletes, multiple different sports. I can tell you that she is as competitive and driven and athletic as anybody we've ever worked with. I am Jeremy Burnham. I'm an orthopedic surgeon. I specialize in sports medicine, and I'm the medical director of sports medicine for Ochsner Baton Rouge. All right, you guys want to do a timeout?
SED Bearhooker on, what are we here for?
We're doing a right knee scope, ACL reconstruction with quad tendon autograft.
Get it, girl, come on.
Corinna injured her knee during an obstacle race. During that injury, she tore her ACL. And the ACL is one of the most important ligaments in the knee. It provides stability between the shin bone and the thigh bone. And so when that ligament tears, most of the time it will not heal itself. And most of the time it needs to be treated surgically. Because what we're trying to do is get a partial thickness piece of the quad tendon. We don't want to take the whole quad tendon, and we're trying not to go full thickness if we can, so that the quad muscle and quad tendon is still intact and still works optimally even after we take a little strip of this graft out of there. I walked on the football team at LSU and had the opportunity to play under Coach Nick Saban. But actually, in my playing career, I had a knee injury. When you are an athlete and your identity is in competition and that gets taken away in the blink of an eye, that's a feeling that you'll never forget. So this is kind of what it looks like, kind of coming out of the knee. And so we've got a strip, but we've preserved the rest of the quad tendon. And then you'll see Jericho take it to the back table and prepare it and turn it into an ACL. Good. Nice, there's a button. I'll follow you in there if you want me to.
Because I didn't get any meniscus repair done, I could be technically weight bearing right after the surgery. But I learned very quickly that that wasn't going to happen anytime really soon.
Because of the timeline for the ACL healing, though, you also have to know when to pull that motivation back a little bit. Somebody like Corinna, being such a good athlete, such a hard worker, is always going to be pushing those boundaries just a little bit, trying to get back as fast as she can. You need to keep being careful with it, right? Mm-hmm. So that ACL is still weaker now than it was when we put it in 6 weeks ago. If you think about ACL rehab as a year-long process, we're not even through the first quarter yet. So that's how early we are. So with you, we don't want to go from 0 to 90.
This is just all like air just puts in. And just like a little baby jog.
And now you're rocking.
Now we're down.
If I'm going 5.5 miles an hour, it's only an 11-minute pace. Yeah, really?
6 miles an hour would be 10.
Really? Yeah. Going slow.
I feel like I'm cruising.
I feel like I'm flying. Yeah, no.
I know what it's like to have the one thing that you're working for taken away from you. You're gonna press out into this as hard as you can.
Okay, ready?
Mhm.